Hello, I'm Dr. Tim Romanowski,
And I'm Valerie Wallace.
and we're with Warrior Medical Group here today to discuss direct primary care.
Can you explain direct primary care and how it's different from regular health care?
Absolutely. So direct primary care is a newer model of distributing healthcare to our patients. Most of us are very familiar with the current system where people have insurance, they call up their doctor, have to wait months on end for even the simplest thing. Then they're charged with co-pays and unsure if their bills are going to be paid due to deductibles and other issues with the healthcare system. With direct primary care, we kind of cut out this middleman of the insurance. And we just charge a monthly membership fee, which then grants you access to your care team through telephone calls, emails, text messages, televisits, and office visits.
Great. Why did you choose DPC for our practice? And what are the perks for the providers and the patients?
Sure. So we both were, in a system that was not friendly to either the providers or to the patients. A lot of barriers were being put up on both sides. And this is unfortunately due to the way things are currently run. The insurances are what pay doctor salary, hospital costs, and they continue to cut reimbursement. Well, then the hospital comes back and starts looking at performance of the doctors. Well, why aren't you seeing enough patients? You're not coding enough. And then you are stuck seeing 20, 30, 35 patients a day, and you aren't able to deliver that good care. When you come into a doctor's office, the current system, you're scheduled for about a 20-minute appointment. So unfortunately, your provider is late. So you're sitting there for another half hour. Then the MA brings you back and starts asking you all these questions that has nothing to do with your appointment. They're fulfilling some metric to satisfy a reimbursement scheme from Medicare or the insurance companies. So you're getting annoyed by that. Then finally, your provider comes in the room. And so we're now down to about a 10-minute appointment. You start complaining for the next 5 minutes. Why was I just asked about all those questions? Oh, by the way, your front desk is very rude. They didn't give me the time of day. Oh, I can't get in with you in a timely manner. So that's another 5 minutes gone. Now I have 5 minutes to figure out why you're here, to examine you and come up with a comprehensive care plan. Oh, and by the way, I don't have time for that. You only get one problem today. I know you have a laundry list, you have an A, B, C, and D list. Sorry, pick one. And then we'll have to bring you back at some point. How is this good care? It's not. We lost that doctor-patient relationship. With the direct primary care model, we're not limited to these small time frames. We can put our schedules to best fit the patient's needs. We are templated for about 30 minutes. When was the last time we actually did a 30-minute appointment? It's very rare. You come in, we chat, an hour maybe, 45 minutes, an hour, and we actually find out what's going on. What are your actual needs? We talk about a quote. It says, if you ask a patient or listen to a patient, they'll tell you what's wrong. If you listen a little bit longer, they'll tell you what they want. But if you listen just a little bit longer, they'll tell you what they need. That's what direct primary care about, is fulfilling that need.
So what would you say is the main idea behind Warrior Medical Group and explaining kind of the services and membership details that we have to offer?
Sure. So the main idea about the Warrior Medical Group is to get back to that hometown doctor, the doctor who knows you, the doctor you could call up. Hey, this is what's going on. Do I need to come and see you? Like, nope. We have this relationship. You get this sinus infection this time every single year. Let me just send in that antibiotic. I don't want you to take time off of work and waste your money, your gas to come and see me when I know you enough that I can just take care of this right here and now. Oh, your family member has an issue. Give me 5 minutes. Let me call around. Okay, this person now has this appointment specifically for them. So it's about making that connection.
That's excellent. How would you explain to people how we're able to get people in same day or next day for appointments? versus the traditional system?
So the traditional system, it's very much based on numbers. We have to push as many people in as we can, which then overtaxes the provider and fills up the schedule. When I was practicing at my old office, my next same day appointment, so you're sick this day, was 3 weeks away. And that just doesn't make any sense because I have to get you in. I need that, put in that billing code so I can get paid. With the direct primary care model, we kind of flip that on its head. You pay the monthly membership fee. You can talk to me anytime, and we don't have to cram people in. A busy day for even a mature direct primary care practice is about 5 patients. So our goal is never to have a full waiting room. Yes, other docs have looked at us like, how are you surviving? You don't have anybody in the room. It's like, that's the goal. I'm actually doing my job. I'm keeping people out of here. I've made that connection. I've helped them.
So you talked about, you spoke about the cost of Warrior Medical Group. And could you explain that a little further and what that entails?
So absolutely. So what we do is we offer monthly membership plans. We do offer discounts to veterans, healthcare workers, police, fire, EMS, first line responders, and educators to help cut the costs. And that cost, like I said, gets you the access that you need to us through telephone calls, emails, text messages, office visits, and televisits. We also offer rates for children. So we'll see lowest age we'll see is 13, up to 17. That's $50 with a paying adult. 18 to 25 is $75, and then from then on, we have the different packages, and we also offer couples rates.
Well, you talked about co-pays before. Is that something that would be part of Warrior Medical Group?
Warrior Medical Group does not take any copay, since the copay is a contract that you have signed with your insurance company that you pay this to the doctor just for the privilege of walking in. We don't do that. There's no need for us, because that copay also fulfills our contract with the insurance company that they're getting some form of money from you. And we are trying to change the system.
You spoke earlier about not needing insurance to be part of our practice. So if someone has insurance, how would you justify coming into a practice like ours?
Okay. So, we all carry around that little plastic card in our wallet, and that's what we all consider healthcare. Well, what does that little card get you? It gets you a 3-month wait for simplest things, for follow-ups. It doesn't really provide you with what you're seeking, that relationship, fulfilling that need. So do we still use insurance? Yes, we do. We use it for imaging, labs, your specialists, of course, your medications. But if for some reason we need to go outside the insurance, or if you don't have insurance, we have actually contracted to have specialized rates for our members that tend to be cheaper than what the insurance would be.
That's excellent. How would you say that Warrior Medical Group makes healthcare more personal, and how does it improve the doctor-patient relationship that you've seen with your patients?
So it brings it to a very new level. Most of the time, even in the old practice, is you're not listening. You don't have that time for me. It's like that just eats at us, because there's more we can do, what we need to do. So by establishing a better relationship, taking the time, hey, this is your time. We're not going to focus on anything else. I don't have 20 other people I need to see right now. This is your time. Let's talk. What is most important to you today? And let's figure that out. You want to talk to me about the problem that your spouse is having? Well, this affects your health. Let's do it. Your kid is having an issue. This all affects you. So let's sit down, talk, make that connection, come up with a game plan together. I've always said you're the expert in you. I'm just the consultant. Without you giving me that information, I can't do anything.
What would you say is the best use of technology in Warrior Medical Group?
The best use of technology? So we all carry around these peripheral brains with us, known as smartphones. So we can do televisits with them, and then just a simple text message. There is not a day where I'm not texting a couple patients about an issue they're having. And sometimes it's, hey, do I need to come in for this? Like, no, this is what we're going to do. Or yes, let's get you in. You need a refill? I'll get that in right now for you. It brings in a more communicative response from both sides. Because in the old system, docs are just so overwhelmed, messages get left behind for days on end. You call in to a lot of practices right now and they'll say, oh, we'll respond to you within 48 business hours. Well, I have this need now. That's not helpful. By doing our model, we have that connection. We have the ability to respond faster and make sure things are taken care of in a timely manner.
So this question gets brought up a lot in our practice when people come in to see us and they're trying to grapple with the DPC model and how that works with our traditional brain for healthcare. And it is the idea of like, how does this work when, if you get to a point that you need to refer me or another patient to a specialist, how does that work with our insurance at that point?
It works the same way it does now. We send the referral. Since the specialist is the one who's using your insurance, they have the authorization from us, they can charge your insurance. We've set up with the different portals. Some insurances do require specialized referrals. We still do that. It's to make the system or the process smoother for our patients. So insurance is still our standard. We will use it. We've learned some tricks. We're going to help you navigate better.
When people look at paying for their provider, we typically view the concierge model and think this is similar to what we do. Can you explain how it's different and how you try to adjust for economic use of their healthcare dollars?
So in the traditional concierge model, the doc will take your insurance, will charge you your copay, and will also take that extra fee, your monthly fee or yearly fee. We cut that out. That's really expensive for people. So we take away the insurance part. We take away collecting those extra fees, and yes, we give you a monthly rate. But that does two things. It guarantees that you can see us, guarantees that you can access us however you need to. It doesn't give you the front of the line service like the concierge model is supposed to, but you get us directly. You get your whole care team. And then we don't take the extra copay, so that's not something else that's coming out of your pocket. And so we do encourage people to still keep insurance for the referrals for something catastrophic. But like I said, if we need to, we have cheaper rates for labs, imaging. We are conscious of our money, and we're trying to be conscious of your money.
And I think it's important to note in this whole conversation how, if you could explain the difference between your patient numbers in a traditional system versus the patient numbers that we see at Warrior Medical Group, and how that gives us each patient benefit for care.
So in the traditional model, each provider, it could range anywhere from 1,500 up to 3,000 plus patients that are assigned, attributed to that provider. There's no way anyone knows that many people successfully manage those issues constantly. With the direct primary care model, it brings that number down to something more attainable. Anywhere between 400 to 750 would be mature patient panel per provider. That way we can keep up that relationship, get to know you, get to know what that need is we need to meet each and every time.
What challenges come with the DPC model now that you're doing this, and how do you handle them?
So the biggest challenge right now is education. Like we said, is why should I come to you? I'm paying insurance. Well, again, what is that insurance getting you except frustration? So that is the big challenge. And then it's just getting our name out there.
How happy are your patients with Warrior Medical Group, and how do you keep them satisfied?
So we keep them satisfied by having that communication. And honestly, through this model, I've learned that patients are actually more respectful of me and my time and my family's time. I've gotten text messages at night, and the first thing it says, do not respond to this. This is not that important. Please spend time with your family. And of course, I'm going to take care of it right away. But that's part of it. You develop that relationship. It makes people happy, makes them feel heard and wanted. Like someone actually is listening and actually cares about me.
And I think it's invaluable to mention that as a healthcare provider, there's a lot of strains on primary care providers in this country right now to meet these needs and working 12-hour days. And I think the fact that you can give quality of life back to your provider makes your provider that much better for you, and vice versa.
Absolutely. When we opened, one of my patients followed me. First thing she gave me a hug. First thing she said was, "You're a changed man. You are the original doc I walked into. When you left your old practice, you were defeated. This is not who you are. You have returned to that caring provider."
And it's wonderful to see people get excited and be happy to be there and feel like a family in the office. I think that's, we tend to think of people as patients, but we really are, we're a family.
Exactly. And on my side, it's the mental health of men actually has improved. Men are more open to communicate with me because, again, they feel like they're being heard for the first time. It's not one of these things where we just have to suck it up and deal because I don't have time or no one cares. They see that, yes, this model is different. It affords me what I need.
That's excellent. How do you manage emergencies or things that are not covered by the medical fee?
So this goes under insurance. That's why we ask people to maintain some form of insurance, especially for catastrophic. So cover urgent cares or emergency room. But the first step is contact me, contact us. Do we actually need to send you to that urgent care? Oh, you're just having the sniffles this weekend. No, we probably don't need to go to the urgent care because they're just going to pass you along to the emergency room if they're too full. Some things we can handle, if you need sutures, just let's do this real fast. Don't go to the ER for your 3-hour wait. I can get you in right now. So it's decreasing overall healthcare costs by not utilizing these high resources.